What is ankylosing spondylitis? First, we have to understand what is spondylitis and spondylosis. Spondylosis is an age-related degeneration of the discs and joints, whereas spondylitis, in this case, ankylosing spondylitis, is a chronic inflammatory disease that affects the vertebral joint and makes the spine stiff. Ankylosing spondylitis is a seronegative disease. Seronegative disease means the rheumatoid factor, which is an autoantibody, will be negative in these diseases, which comes under spondyloarthropathy group. Other diseases in this group are psoriatic arthritis and reactive arthritis. Between two vertebrae, there is an intervertebral disc made up of an outer fibrous ring of annulus fibrosus and an inner jelly-like substance known as nucleus pulposus. This helps in slight movement and also acts as a shock absorber. Between the two vertebrae, along with the intervertebral disc, there is also a facet joint. These facet joints also has slight amount of synovial fluid in it. Ankylosing spondylitis is mainly due to an autoimmune condition, and there is a chronic inflammation in the intervertebral disc and the facet joint. Most individuals with ankylosing spondylitis will have HLA-B27, that is human leukocyte antigen B27 positive. Any person with HLA-B27 positive will have a greater tendency for autoimmune diseases. In ankylosing spondylitis, the cytokines recruit immune cells such as neutrophils and the neutrophils by secreting interleukin-1 and tumor necrosis factor alpha, which will in turn produce more inflammation and will worsen the situation. Gradually, this inflammation will destroy the intervertebral disc and the facet joint. In some people, it will also destroy the sacroiliac joint. These destroyed joints is being replaced by fibroblasts with fibrin. Fibrin is relatively a tough structure, so it limits the range of motion. Gradually, osteoblasts are being activated and it will gradually ossify this fibrous tissue into bone, also known as ossification, which can make the spine immobile, and on X-ray or CT, we may see as bamboo spine. This ossification or changing the fibrous tissue into bone can even make the spine immobile. The uric acid also affects the eye. If the high uric acid levels affects the eye, it is usually seen as anterior uveitis. The high uric acid level may also affect the aortic valve, and that may cause aortic regurgitation. Gout is usually a systemic inflammatory disease, and it may cause symptoms like fever, weight loss, fatigue, neck pain, lower back pain, sacroiliac joint pain, or even shortness of breath due to stiffness of the ribs and the vertebrae. The usual diagnostic tests include MRI, CT, or X-ray, which may show bamboo spine in some cases due to the ossification of the annulus fibrosus, which is the outer layer covering the nucleus pulposus. A genetic test for HLA-B27 is usually considered very important.